Hello, Miss. My name is Rao, son of Jagannath. My ID number is 2450025 BHCM. I am here to present my presentation, which is Hospital Sanitation Support Service. The Hospital Support Service. The Hospital Support Service is an organized system that ensures cleanliness and hygiene within the hospital wards. Uh, and create an environment of infection-free environment. It's very important because hospital sanitation service ensures the safety of patient from high risk disease spread because they are vulnerable patient in hospital wards. It is hospital sanitation service follows a strict medical standards, unlike like general commercial cleaning like in office spaces. It also ensures hygiene to support safe patient care and promote prevent hospital acquired infections. The way sanitation service operates, uh, it uses like the technicians and housekeeping staff within the hospital wards and hospital environment, and it requires equipments like disinfection, standardized cleaning protocols and tools. Staff also must understand routine cleaning and disinfection process and also sterilization. It ensures proper workflow, and the clean items must be separated from the contaminated one. After the sanitation process, the waste that comes from the process must be segregated and properly disposed. The next one is I will be explaining about the design elements of sanitation facilities. The first one is toilets or bathrooms within hospitals. Toilets and bathroom usually strategically located within near hospital wards and outpatient wards. It's also there are also separated toilets for the patient, the staffs that work in the hospital, and for visitors. These hospitals are designed in a way that there's always like designed with non-slip and easy to clean flooring and resistant walls. There's also like automatic hand-free systems like sensor depth for sinks and then automatic flush system. There are also adequate ventilation system to control the odors, the smell around in the toilets, and maintain a safe environment within the toilet, and protect the visitors, the staff, the patient from airborne microorganisms. Accessible toilets there are also accessible toilets provided for disabled patient who can move on their own. There's structures in place within the toilets that they can use to move assist themselves to move in the toilet. Frequently supplied These toilets are regularly supplied with soap and hand drying facilities within the hospital. The next one is hand washing system. Hand washing system installed at entrances and treatment rooms and isolation areas, designed for hands-free operation, like I said previously, like sensor taps for hand washing. They don't have to touch the surface of the pipe. There are also clear signage of promoting proper technique to wash your hands, and supply with uh, antimicrobial soap and alcohol based hand rubs. And these things within the hospital also designed in a way doesn't uh, doesn't if anyone were to use the sink, it doesn't overflow and the water doesn't get on the floor. It also strategically placed within the hospital to have easy access for visitors and for the hospital staff to encourage the frequent use of the sinks to promote a healthy sanitization culture. The third one is waste collection points. The design element of waste collection points. At the end of the sanitation process, there are always waste that must be disposed, and they will be gathered in the waste collection points, and there are clearly designated areas for to separate the waste into like hazardous waste and general and clinical waste. There are color coded bins to support proper waste disposal, and uh, within the waste collection point there are also foot pedals to minimize the hand contacts of the staff, because possibly they can if they got any disease they could spread to others around the hospitals. The waste collection point is also located away from the patient areas and the cafeteria areas. Any areas that fills with the people or the crowd is away from that. The waste collection point is also equipped with easy to clean surfaces and regular disinfection schedules. It also has temporary storage areas acquired to as areas secured to prevent unauthorized access. The fourth one is the drainage system. The drainage system in the hospital ensures efficient workflow and prevent water stagnation. Equipped with traps to prevent backflow in odors or past entries, the materials that makes the drainage system are using like proper materials like durable metals and corrosion resistant materials to avoid like rusting. The separated drainage for wastewater and hazardous liquid. There are separated drainage system for get rid of hazardous waste and like hazardous liquid system uh, uh, hazardous liquid waste. There are also regular access point for maintenance and clinic within the hospitals. Yeah, and the drainage system is in every hospital has to have compliant with medical standards and safety regulations. Now I will be explaining some of the functions of some of the functions of some of the hospital sanitization service. The first one is waste management. Waste management purposes is to safely segregate the waste from all areas of the hospitals. There are also infectious waste and non-infectious waste, and they are properly need to be segregated in order to dispose properly, especially hazardous waste. Waste management also serves as a proper collection, storage, and disposal to prevent cross contamination in the hospital. It aims to protect the staff that works within the hospital, the patients, and the visitors, and create an environment of a health risk free environment. Have waste management also have compliance with hospital policies and environmental regulations. The second one is cleaning protocols. Cleaning protocols means it's about the routine and scheduled cleaning process in all areas of the hospital, especially like hospital wards, the ICU department, the cafeteria, and the laboratory. All hospital areas. Cleaning protocol is mainly for the removal of dirt, spilled, and biological and hazardous as contaminants from the surface. They use like approved disinfectant and standardized procedures to properly maintain the cleanness around the hospitals, because the cleaners they have to use the approved one, because the protocols about the for the cleaning around the hospital strictly follows like medical standards to create an infection free environment. The in cleaning protocols also means like cleaning protocol is mainly for the maintenance of safe and orderly and comfortable environment for patient and the visitors. The the third one is hygiene maintenance. Hygiene maintenance is about the provision of clean toilets, hand washing station, and hygiene supplies. Hygiene maintenance is about the promotion of hand hygiene practices among the staff and visitors, like properly hand washing, and like cutting your nails, cleaning, and make sure your hands are properly cleaned before you enter the hospital environment. And the hygiene maintenance is also about prevention of cross contamination through clean facilities. It supports patients' comfort in the hospital and their dignity. The fourth one is infection control. Infection control is about the reduction of hospital acquired infections, which in short like HAI. Uh, Infection control is also is about elimination of pathogen from high risk areas and high touch tools. And for instance, like the Central Sterile Service Department is heavily involved in infection control as well, as their job is to properly sterilize the tools that used from the surgery ward, so they can be properly sterilize the tools used from the surgery ward, so they can use again for the next surgery for the next patient. If not properly cleaned and sterile, then the next patient from the surgery can get some kind of disease infection. Infection control also supports for isolation precaution and uh, outbreak prevention. uh, Infection control, in summary, is all about protection of vulnerable patient, healthcare workers, and the visitors all around the people who in the hospital. Now I'll be moving on to the next slide, which is the importance of sanitization service. Sanitization service is very important in every hospital. In healthcare management generally is very important, because Sanitization is what it's directly connected with patient outcome and patient safety within the hospital. A clean and hygienic environment can promote uh, proper patient outcome. A clean and hygienic environment can give patient a better healthcare experience in the hospital and reduce the risk of HHAI, which is hospital acquired infections. Hospital acquired infection, if a patient were to get a HAI, hospital acquired infection, they can have a prolonged hospital stays and increased treatment costs and higher patient morbidity and mortality rates. Effective sanitization includes like proper cleaning, disinfection, sterilization, and also hygiene maintenance around all hospital areas. It helps reduce harmful microorganisms from hospital area surfaces and hospital equipment and clinical areas around the hospital. The in the sanitization service also protects vulnerable patients with weakened immune system. Weakened immune system. Patients with weakened immune system are usually elderly people, and uh, we need to the hospital has to be extra careful in protecting them from infections. And the like produces, in addition, a well maintained hospital environment improve patient comfort and confidence and satisfaction of the healthcare provided, of the healthcare experience provided to them by the hospital. It also improve hospital quality standards and uh, achieving better patient health outcomes. Now, moving on to the next slide, challenges and solution in hospital sanitization services. The challenges, there are two of them. The first one is staff shortages and training gaps. The challenges in this is obviously staff shortage and training gaps, but the main challenge is the hospital is struggling to maintain an adequate number of trained staff for the hospital sanitization service, because uh, the main reason is if there is not if there are staff shortages in the hospital in the sanitization service, the staff who already work there may be overworked because of the staff shortage. Another problem is inexperienced staff. There are no staff shortages, but because some of the staff are inexperienced, they also could make some critical mistake during their work. This overwork and also inexperienced staff is they can both make critical mistakes during the work. Critical mistakes meaning like using incorrect disinfectants and failing to follow proper protocols during the sanitization process, failing to follow infection control procedures, and because of these mistakes they can increase the risk of HAI, which is hospital acquired infections. They can create a risk of infection, cross contamination towards the patients themselves and the visitors who visit the hospitals. The solution is there must be comprehension and ongoing training programs that must be held for the inexperienced staff. The training programs must include about training about infection control and cleaning procedures and proper use of cleaning chemicals and the proper methods. Certification program must also be held uh, uh, during time to time to ensure staff competency to protocols and policies of the sanitization service, and also have maintain an adequate number of staff in the hospital sanitization service at all times, because this will reduce distribute workloads properly distribute workload to every staff, so that if there's a sudden staff shortages, the rest of the staff won't be overworked and they won't make mistakes. And uh, and in addition for the solution, uh, uh, the sanitization service also can use technologies like checklists and monitoring apps to track cleaning compliance and performance, just in case to avoid making mistakes during the sanitization service. The second one in challenges and solution in hospital sanitization service is uh, the constraint. Resource constraint is for the hospital budget. Hospital budgets can vary depending on the hospital. Some hospital have bigger budgets, some hospital have small budgets, depends on the hospital. The budget limitation can restrict access to proper sanitization resources if there are not enough budgets uh, to buy the proper resources that they demand, then they can give a proper service to the hospital. These sanitization resources can put includes like cleaning supplies, disinfectants, protective gear for the staff, and modern sanitization equipment. This can force hospital to prioritize one areas over the others with the little resources that they have, little sanitization resources that they have. This will eventually will result in one place being cleaner than the other places, which can also increase the risk of HAI, hospital acquired infections, and increasing infection rates for visitors and patients all around. That is the challenges. The solution would be properly optimize the resources by identifying high risk areas and frequently and also areas that require frequent cleaning, like the surgical wards and the ICU department. The hospital with smaller budget can also implement cost effective budgeting techniques, and by buying cost effective disinfectants and cleaning supplies and tools. The pledging uh, chat can the planning budget strategically for cleanings critical sanitization needs only, like period pre periodic evaluation of supplies usage can also prevent waste and ensure essential resources are available when needed. Moving on moving on to the next slide. uh, Examples of good practices and innovation in hospital sanitization. The first one, there are two of them. The first one is antimicrobial surface materials. The antimicrobial surface material aim to reduce infections to frequent aim to reduce the spread of infection through frequently touched surfaces. Antimicrobial surface material usually uh, coated with antimicrobial agents with copper alloys and surface materials. These surface material are usually installed in bed rails and door handle, light switches and workstation, and many more areas within the hospitals. These antimicrobial surface can kill or inhibit the growth of bacteria and viruses that can potentially be harmful towards the patients and the visitors and the hospital personnel. It's This antimicrobial surfaces is pretty useful in hospital wards, high risk hospital wards, and also the intensive care units ward, and operating theaters. It can Antimicrobial surface can reduce HAI, hospital acquired infections, and uh, proper healthcare experience to the patient, and resulting in better patient outcome, supporting infection controls, and enhance overall patient safety. The second example of good practices and innovation in hospital sanitization is the use of UVC disinfection robots. The UVC disinfection robots is a advanced sanitization innovation that enhances infection control within the hospital environment. Uh, the UVC disinfection robots, the way the robot works is it emits uh, like U ultraviolet UVC light, which are scientifically proven to destroy the DNA and RNA of bacteria, viruses, and many other microorganisms, preventing them from reproducing and becoming a threat to the a threat that causing an infection risk towards the patients and the healthcare staff that works in the hospital. This UVC disinfection robot is especially very useful in patient rooms, in ICU, in emergency department, and also in overall high risk areas in the hospitals, high risk infection areas in the hospitals. This The UVC disinfection robots can also reach areas uh, that humans forgot to reach or simply cannot reach, like uh, the UVC disinfection robot can disinfect the surfaces of the mixed by stuff such as corners, shadows, and high touch surfaces, and also low touch surfaces as well. This UVC disinfection robots can help reduce human error and improve overall cleaning effectiveness, and improve infection control, help sanitization service very well. The UVC disinfection robots help reduce hospital acquired infection, AHAI, and also create in resulting in creating a safer clinical environment in the hospital. Moving on to the last slide, which is the conclusion. As a conclusion, the hospital sanitization service are very a vital system in every hospital to ensure a hygienic and clean hospital environment. Through proper facility design, effective cleaning protocols, and waste management and infection control measures, the sanitization service can help prevent hospital-acquired infections and uh, supporting the patients' faster recovery and supporting patients and the healthcare staff from infections. Although there can be challenges such as budget constraints and shortages of staff and training gaps within the staffs, but they can be solved through solutions. It's not impossible. And also there are innovation practices and technologies that have strengthened the sanitization management within the hospital in the modern healthcare era, resulting in much better infection control in the hospital. Overall, the hospital sanitization services play a very critical role uh, for the safety and overall well-being of all the staff, visitors, and patients. No one can deny their involvement um, in the healthcare services and overall contributing for patient safety, service quality, and smooth functioning of healthcare services.